Great. Thank you so much. Good morning, everyone. This is the Assembly's Health Policy Committee. Today is March 2nd. It's 10:01 a.m. Ms. Leppy, could you please call the roll?
Yes, I can. Mr. Presverdia?
He is excused.
Okay. Ms. Zolotel?
Here.
Ms. Allard? Ms. LaFrance?
Here.
Mr. Constant? Ms. Quinn Davidson?
Here.
Mr. Dunbar? And Mr. Rivera?
Present.
Thank you.
Great. Thank you so much. So we have a pretty robust agenda today. We're going to start a little bit in a different order. We're going to start with the Anchorage Health Department, but we're going to start with general overview updates from the health department. Then we'll move into COVID because we have a couple of COVID related items, and then we'll do the Community Health Advisory Committee update. So I want to thank Director Gervais for joining us today, and I'm going to turn the floor over to you, sir. Thank you.
Well, thank you very much. I want to say thank you for having us here, and we got some really valuable questions ahead of time so that we could provide some pretty in-depth answers, and we appreciate that, and we have time to research stuff fully. General overview of the health department, I think you, most of the assembly members are aware that we've had a pretty good fill rate of our senior positions. We went through a traditional recruiting hiring process. We onboarded a division manager for the administrative division and a division manager for the public health division. Both are seasoned public health officials, one being a 14-year veteran of Colorado public health and the other being a local from the Mat-Su Valley with over 10 years of public health experience. Very exciting. We did have the departure of our human services division director on Friday, and we are actively, it's actually out to be posted today. So we're not letting any moss grow in the stone. We are quickly posting that job to fill that position. And I'm having network quality, so I'm gonna turn my camera off. So that's exciting. We have filled some other key positions inside our homeless response division here at the health department. And as you know, we've added some strength to our contractor strength around our operations, both congregate and non-congregate. And that has made us much more timely in responding to concerns at those sites, whether it be the congregate site issues or the non-congregate. They kind of differ based on that. Additionally, having added some people to the finance section contractor, FEMA contractors, has allowed us to be proactive, and we are ready to come before the assembly with the remaining appropriation documents to get out through the end of June. So that's instead of being reactionary, we're being proactive on the response. So we're looking very good to have a number in front of the assembly for the remainder of the mass care operation. So that's a general high-level view, pending any questions maybe.
Great. Thank you, Director Gervais. We were joined by Mr. Dunbar at 10:02 and Mr. Weddleton at 10:04. Members, if you have any questions, please pop them in the queue. And first up is Mr. Rivera.
Yeah, thank you, Madam Chair. And thank you, Mr. Gervais, for that presentation. Just quick question, and maybe you mentioned this and I missed it. Is there an update on the hiring status for the new homelessness coordinator in the health department?
Has been hired from an internal that was an administrative person in another division. So those homeless resource coordinator positions are all filled at the health department in that division, headed by Andy Nestor, and the rest of the subordinate positions in that department have been filled at this time. We are missing a admin officer, but it doesn't relate directly to homeless response. It's a department position, not a specific to homelessness, but those homeless resource coordinators are all currently filled and in place and working.
Great. And I'm wondering, as a follow-up, so the public and the administration the public and the assembly is used to a homeless coordinator with a certain sort of set of responsibilities. Can you just are we expecting the same, or is there a change in the types of responsibilities that the new homelessness coordinator will have?
There would not be, and to be clear, we would have had to do that before we posted the job. So we use the same PD, which is the job description in the civilian world. Our PD covers all those tasks, and they are unchanged from the historic duties and responsibilities of that position, sir.
Okay, thank you.
Great. Thank you, Mr. Rivera. Thank you, Director Jurace. Any other questions on general health department operations before we switch over and talk about COVID? I am seeing none. We will, if something comes up, we can always circle back. So I did want to highlight for members, and it is on the website, a metrics report was submitted by the health department and it was posted, so all members should have that. And with that, I will turn it back over to Director Jurace to give us the high level view regarding COVID-19. Thank you.
Absolutely. Thank you again. Getting into COVID-19 specifics, I think you've all seen that the last week or so has been very dramatic with changes. For instance, we went from red to yellow. That isn't a health department decision. That's beyond our scope, but we react to it. In addition to that, there's been a lot of things change as far as CDC masking guidance. I think you've seen a lot of discussion about misinformation and bad information around pediatric vaccinations, resulting in the American Academy of Pediatrics, the AAP, issuing some identified causations around pediatric hesitation. So we've identified that, and we are working to address that. This is one of the blessings about having a pediatrician on staff, is that this is a old hat for him to address some of these. Childhood vaccination hesitation is not exclusive to the COVID-19 vaccination. There's a lot of folks out there that resist the vaccines, and that has an impact of all vaccinations across pediatric disease. So we are not reacting just to the COVID-19. It's vaccine hesitancy. It's been that they haven't been to school for 2 years. It's been that people aren't asking if their kids are vaccinated for chickenpox and a ton of other childhood diseases. And as you know, in Alaska, we've got some unique opportunities around pediatric vaccinations and some of the things that happen just because of Alaska and our indoor lifestyle during the times of the year, and clean air and other items that result in I'm trying to think of the proper way here, childhood opportunities for the health department beyond the COVID-19 vaccination exclusively. So I could pause there because I'm sure there's some questions around some of the recent CDC changes and childhood vaccinations, and then I can address some of the other things that the committee has asked. Pending any questions?
Thank you, Director Jurace. Note for the record, at 10:08, we were joined by Ms. Allard. Are there any questions so far for the director? I'm not seeing any, so I would just push ahead and we'll see if any pop up.
Thank you. And I know I speak fast. I have a lot of material to present. There was some questions recently about the COVID-19 outreach programs, funding sources. I think I see it on your 3I there, or AI, is about language testing. I could address all those. I could probably spend a half hour talking about the community outreach and the steps that the public health nursing team, in conjunction with our medical countermeasures team, have taken. We were out during Ferrandi making the rounds and talking to people. This is bigger than just COVID-19. It's about getting out in the community and talking about all the opportunities to prevent disease transmission. Around the language question, we have furnished our language plan. Is a standing plan we've had for years at the health department. We take this very seriously. We took it seriously with our contract providers when we were doing vaccinations and testing, and we continue to take it seriously. Most recently, we updated it to reflect the change in the chief equity officer position, and so it causes us to update this regularly. We have documents, we have consent forms, we have signage in 40 plus languages available. In fact, I could share a picture of the glass wall at one of the clinics where we had please come get vaccinated in over 40 different languages that were created based on the demographics of Anchorage in particular, and to try to encourage vaccination. In addition, just to tell people, we do have a language line, and should anyone come in or need assistance, the language line is actually one of our preferred methods, because these folks that answer these lines are certified in delivering medical information that sometimes lay people couldn't communicate using like a family member translator. So we like to use it as an additional resource to make sure that if we're giving some medical information, that medical information is relayed properly to the patient, because sometimes stuff doesn't quite translate for our providers as they're speaking to the recipient of the information. So we do have a language line, and we can do over 122 languages with that line. There's visual cues they can help identify, so they don't have to be able to communicate in English whatsoever with our staff. If we realize there's a language barrier to access or assistance, we have a sheet that we have that we show them, and hopefully they can pick out their native language. And then we identify that to the language line, and they take over from there, interacting with our medical providers to render a appropriate medical translation for the information to the patient, and then receive signs, symptoms, complaints back and deliver them properly to the medical provider. And they'll interact with the client to establish, to make sure to get clarity for our medical providers. So I know that came up, and that was one of the questions. I could pause there. I think I saw some questions maybe.
Yes, thank you. Ms. Allard. Ms. Allard, you're in the queue. Perhaps she's having an issue unmuting. That happens sometimes on Teams. So when we hear from her, we will jump to her question. But I don't have any other questions yet.
I think I saw Mr. Rivera put a question in too, ma'am.
That was the previous topic.
Oh,
so thank you.
Sorry,
yeah.
my screen's not that big on this computer. It's a laptop. I would note too, around COVID-19 vaccination testing and outreach, we did receive from the state an additional $2 million grant that we just received in the last couple of weeks. We suspected it was coming. As the Assembly is well aware, the funding that you had provided, we had expended almost all of it prior to cessation of the operations that we had. So we now have received a $2 million grant for COVID-19 community outreach and around equity and diversity and some other specific pieces to that program. And we just received the grant, and we just started working it this week. So hopefully when we report back next month, we will have had a much improved outreach plan. We have current outreach and operations going on now around shut-ins, around ALFs, and around at-risk communities. In fact, we were out Thursday at historically underserved communities, but this will allow us to have a much greater outreach program around those opportunities. So it's very exciting. I may not sound it, but it is really an exciting opportunity to ask to ask and receive a grant around that. And it's just been, sent to us as approved and fully signed. So as we have more operating parameters, we will be soliciting input from all of our community partners and those sort of things. And I'll pause there because I'm hearing a ton of chat stuff pop in.
Yes, thank you. Mr. Rivera, please.
Yeah, thank you, Madam Chair. At this time, I think I would like to open the floor, if you approve, Madam Chair, to the individual organizations that reached out to the Assembly with their concerns regarding language access. So the three organizations were the Alaska Literacy Program, ACPIRG, and Catholic Social Services. I think it would be appropriate if there are any representatives from those organizations at this time for them to share. Thank you.
Sure, we can do that. We can, basically, it was the next item on the agenda, the COVID testing language access. So I'll open the floor up. I believe we have Ms. Pickett from the Alaska Literacy Project. Did you want to kick us off today, Ms. Pickett?
Sure, thank you very much. I'm not used to working in teams, so can you hear me okay?
Loud and clear for me,
Yes.
ma'am.
Yes.
Okay, all right, thank you. All right, Director Drace, it's nice to hear from you and be in another meeting with you. I'm excited about the grant money that you just announced is coming in. That's that's going to be really helpful, and we appreciate it. I have a couple questions to just ask around. Some of it is there has been opportunities for us to have more stability around the testing, and this was really critical more in January than it is at this very moment. But with the changes that happened very quickly, the language access didn't seem to go along with it. And so maybe what would be helpful for us is that if we're finding lived experiences where language access is really an issue, what's the best way for us to address it immediately with the health department potentially, or with the mayor's office? And then another question I have for you to think about, and you might not know now, but are you keeping data on who you're using the language, the medical language line or language link or whatever service that you're using for language access? What languages are being used and at what rate? So that would help us understand what you're seeing as well when we're making decisions on how we do our outreach. And then Nyaboni is here and Aaron is here as well, and they are doing a lot of the really direct work. And I'm also open for questions. Thank you.
Several questions I heard in there, so I'll try to make sure, and if I miss anything, please just re-ask, since there were several integrated questions. The health department in and of itself, if we're talking solely about testing, the health department has not been conducting testing since the early November period. And when we did that through a third-party contractor who had to maintain, as part of that contract, their own language line access, not use the health department's. So in and of itself, the health department doesn't have any current and has not had any current testing operations since November 15th at the latest. We were down to one site come the end of the mid-November. So as far as the language line, we can pull reports. The problem is that it is just our account gets used. So it can tell us how many times we had translation services utilized, but we wouldn't know whether that was from our reproductive health clinic, our STI clinic, one of our many TB clinics. So it would just say that we accessed the language line for Spanish 50 times in the month of December. And so it might not provide the clarity around COVID-19 testing language line access or language access. Now, we do have all the forms for testing and vaccination in Spanish, for instance. We have many other forms for many other languages, and then we have signage for a ton more, trying to encourage people to come in, knowing that if we do hit an obstruction, we have the language line to fall back on, which is just this amazing resource for us. So to answer that question, it's kind of vague, not that I'm intending it. We just are not currently running a testing or vaccination operation in Anchorage from the health department. We provide some ancillary services. We do have grants out to many community organizations to provide some of that, and that might be a better resource if you were looking to target a specific community. We could act as a liaison between the health department and our grantee, trying to access services. We are here to help. We just haven't had, it's not like, I shouldn't say this without maybe some more research, but I am unaware of an instance where a at-risk community asked for assistance and didn't receive it from the health department. And that is not what we're here for. We are here to be that resource. But as far as the language line in a detailed report, we do get that, but it doesn't show. Because we want to protect HIPAA, we wouldn't say we had 50 STD calls and 5 vaccination calls. We're just going to say we got X amount of translation service.
Thank you. Thank you for that. Who is contracting with the testing sites, and whose responsibility is it to get the information out once there are changes amongst those contractors about the hours of the sites, the locations of the sites, so that we would know who to work with. So for example, if we know we've sent somebody to a site for a test who is clearly now a contractor, and they don't receive language access upon requesting it, what's our next step?
Well, none of those are contractors. So I want to be clear. This is what I was trying to say. We have 0 contracted testing or vaccination in Anchorage and have not since November 15th. We're actively involved with many community organizations like Beacon, Capstone, and a ton of others that provide those services, but they're just, it's no different than Walgreens. I have no ability to regulate the practice that Walgreens is involved with. They're not receiving any municipal funds in those operations and have not since the middle of November, around testing since the middle of November. So all those operations are just independent private practices that have set up community spots. The one and only spot was the UAA Alaska Airlines Center, operated by the State Department of Health. And that I would have you interact directly with the State Health Department. We'd be glad to liaison, but we again don't have the ability to direct state action. But we'd be glad to facilitate. We meet with them several times a week in different levels, all the way up to the director and the commissioner meet. So if there's an obstruction, please let us know. We will facilitate a handoff to get that information.
Great. Thank you, Director Gerace. Did we have any of our other guests online who wanted to share anything around language access at this time? No one else? Okay. Any closing comments about COVID testing and language access, either from the director or the Alaska Literacy Project, and then we're going to move on to one more COVID-related topic.
From the health department, I think I've said this, but I'd like to reiterate this. We have 2 MDs. We have an epidemiologist who's an MD, PhD, and teaches medicine at Emory. And we have an amazing epidemiologist that came over from the state of Alaska's Department of Health and Social Services. So we have a 4-person medical epi team that can answer a lot of questions, and they are in the data daily. They're on the CDC calls. They get up early to make, 5 a.m. my team's on watching an 8 a.m. or 9 a.m. presentation on the East Coast. And I think a lot of times that work goes unnoticed. And I'd like to say that I don't want to say trust me, but trust me when I say that they are out there on these calls. When there's going to be a meeting of X group at the federal or state level, they're there, and they're there representing for Alaska and asking the tough questions, because what works in the lower 48 doesn't always work for us. We do have unique, and we recognize that while we're the Anchorage Health Department, we get folks from all over the state. So they always have an eye to Anchorage, but a bigger to Alaska when they're asking questions about, well, that's a great plan. What are you going to do? The testing kits is a great example. They were going to mail testing kits that were sitting in the cold. We were one of the first to identify that putting in mailboxes in Alaska when it was -15 that week, and that was just here in town, I can't imagine elsewhere. And we were one of the groups that prompted, in addition to a bunch of other involved Alaskan community groups, about maybe we could have a central repository where they pick them up. And, our EPI team is intimately involved at all levels, federal, state, local, ensuring that our voice gets heard. And that's really what we use them for. So, and I think I saw some questions, but that would be my last piece. The EPI team is highly involved and highly skilled.
Great, thank you for that. And hopefully we'll be back to an in-person committee meeting soon, and perhaps we could meet some of that team. I think that's something a little bit lost with these these teams meetings. I did on the language access piece see Erin Loporto's hand. You can go ahead, Erin.
Hi, thank you. Thanks again for having us. I just wanted to touch on the testing sites. I hear what you're saying, and that all makes sense to me. But when you mentioned the translated flyers that we already had, one of the issues that we were seeing, and part of the motivation for the letter, was that people would go to a testing site who didn't have very strong English language skills, and then they couldn't understand if it was free or not. And we even had one where someone went to, I think it was a vaccination site, and it was like that itself was free, but they had to pay for the office visit, and that wasn't clear. And another time, somebody was actually at a free site, but they asked the question about insurance, and they weren't able to get clarity that that was just a question. They didn't have to offer that. It didn't mean that they had to pay anything. So if we had some flyers that just mentioned this is a free site or this is not, you might have to pay an office visit, that we could distribute to locations, I think that might be pretty helpful. Thanks.
Excellent.
Thank
I took those notes, and we will offer any of the materials we have to our community partners, but we lost a little of that compelling ability when we stopped being the payer and they went to the private, vaccination model. So I do hear what you're saying, and we will make sure. Luckily, there's only 3 or 4 agencies, so we can reach out to Walgreens, Capstone, Beacon, and Fairweather, and some of the major players in town, and make sure they have the resources to be successful. We'd love to do that. We've already had them all converted, so it's a zero cost benefit and highly beneficial. So.
Great, thank you. I'm glad we made that connection. I have Mr. Rivera in the queue and then Miss Allard. Mr. Rivera, please go ahead.
Yeah, thank you, Madam Chair. I guess just a final comment on this topic from me. It's pretty obvious just based on the discussion today that this is sort of one of the unintended consequences of privatizing. We no longer have that teeth to enforce language access, which is a federal requirement for the municipality to adhere to. And just like we heard a little bit ago from Aaron, I have heard complaints from folks, both on the testing level as well as the vaccination level. For my part, I would hope, and I think I heard that we aren't relinquishing all of our responsibilities, just we don't have the teeth necessarily to enforce. So I hope that we continue to keep pushing whenever we hear these concerns about the lack of language access, so that all parts of our community can be safe and healthy during this pandemic. Thank you.
And I should add on, sir, and to the whole committee, the health department itself gives COVID-19 vaccinations. As we realized this was a struggle, anyone can come into our clinic now, no appointment necessary, and receive the shot 4.5 days a week. One of the days we have a half day for training and other follow-up kind of outreach clinics. So we can't do it both outreach and internal. So, but we are now 5 days a week, 9 to 5. And of course, if you come to the health department, all of our equity provisions apply to us. And we, of course, are 100% compliant with all those things. So not only do we have signs in multiple languages here, it is 100% free, no copays, no, I do know what you're referring to with other companies, but none of that applies at the health department. We are the catch-all for the community, and as such, we would never ask for those things. And we have our full language line support internal here. So, I mean, I should point this out probably at every meeting. Our clinic does vaccinations in general, not just COVID. So people can come here and get anything. We can test you for TB. And of course, we have the STI and reproductive health clinics. So we really have 4 clinics inside of our clinic here, but all of those clinics are language line compliant, form compliant. We have a lot of native speakers on staff, and we can probably do, when I asked the clinic staff, we guess between 20 to 25 languages. We have native language speakers, and we can provide that service. In addition to the language line, you'll probably find many bi or trilingual employees here at the health department. So, and we have an access, we'll bring them down from upstairs. So some of them may not be typical clinic workers, but they work in medical, and we can access them. So I did want to point that out as we're talking to the community. Please, they can walk in here and get their shot. If they hit an obstruction struggle, know that the health department is always the catch-all site for the whole community. That's our role. Thank you.
Great. Thank you, Director Durace. Miss Allard.
Thank you. Can you hear me okay?
I can this time. Yes, please go ahead.
Okay, I apologize. All right, thank you. So I was just going to come back around for a moment because we were talking about vaccines and that we're not necessarily contracted, but there's other organizations that are doing it. Well, I had gone into the health department, and when I went into the health department, I asked for a booster or a vaccine, and I was denied care. They told me that I had to leave. They didn't know who I was. I just came in as like a stray off the street, and they denied me any type of vaccine or booster. And I believe it was, I don't want to mention her name, she's the director down there. She said that I would have to make an appointment. That was really discouraging. And I asked them why, and I proceeded to continue with questioning. And they said it was because they didn't have enough staff. But when I looked at the organization chart, there clearly is enough staff. But when these individuals are continuing to work at home, they're denying care for individuals that are elderly, that they are maybe have language challenges, that are walking in off the street to be able to take their booster or that vaccine at the health department without an appointment, or someone who's homeless, or someone that can only come during certain hours. So I was denied the ability to do that. And they gave me a card and said I'd have to leave and make an appointment. And that's very concerning. Is there any way, Mr. Gerace, that this could be addressed? Because from what I gather, you've given the staff downstairs to be able to tell them, no, you need to. And the individual I was speaking to was a nurse, and she wouldn't do it. And I turned around and looked behind me. I was literally the only person in the lobby. There was not one other person that was waiting for a vaccine or a booster. Can you address that?
I'd be glad to. Again, multiple questions kind of in one. The answer first is we did address it. We instantly, when you identified that problem to me, we, through the proper channels, had the people that handle those kind of complaints address it. We reacted by removing those barriers to pre-registration. And as of Monday, so that was last Wednesday, you identified that problem. By Friday, we had, basically 10 hours a day of vaccination in progress. So on Thursday, we reacted to it. We are not allowing clinic staff to work from home. They are all back to the office. It's a tiered back to the office response. We are also not closing at lunchtime, which we had been historically doing because we figured if somebody's on their lunch, we want to be able to give them a shot here, any shot, not just COVID. I like to talk immunizations in general. And so that did occur. And as of Monday, it's every day of the week except Thursdays are half days. Thursdays is our community outreach day where we take our mobile clinic and we go to the field. So the same team that would provide the vaccinations in clinic is now mobilely deployed. But essentially 5 days, 10 hours a day, no lunch closure. That was all effective Monday, the 28th of February. And I appreciate you bringing that to my attention. I had always been told that if somebody came in without an appointment, if there wasn't people in the clinic, they would make them the appointment and then fulfill it. And it was just about recording the necessary information. And one of the points that we made with our staff was to request the same thing, that when we did have vaccination contractors, we expected them to accept walk-ins up to the capacity of that building. And we basically use the same rules we did use for our contractors for 20 months. We decided to put on our own staff, so we don't treat our own staff any differently. And but it has been addressed. I appreciate you bringing that issue to the forefront. A lot of times that stuff doesn't happen when I'm looking or the senior staff's looking. So it was a very interesting and appreciated report from you. Thank you.
Great. Thank you.
Madam Chair, may I just make a comment?
Yeah, quick, because we got one more and then 2 more items.
Yeah,
Go ahead.
no problem. Thank you. And I think if the health department could maybe disperse more information that says, you can have walk-ins and it's free, that would be wonderful. Thank you, Madam Chair. Thank you, Joe.
Thank you, Ms. Allard. Thank you, Director Gerace. So before we leave the COVID topic, I believe we're joined today by AMLLC, who were the contract tracing folks who worked with the city, and they wanted to provide us a little bit of information. Give about 5 minutes for this. So we do have one more topic, and I want to leave time for audience participation. Is someone with us from AMLLC?
Yes, can you hear me?
Yes, could you please introduce yourself?
Good morning, can you hear me?
Yes.
Thank you. My name is Naftali Odongo, Vice President of Program Delivery at AMLLC. I'd like to start by thanking you for the opportunity to speak to you today, and also express our gratitude on behalf of AMLLC for the opportunity to serve the people of Alaska during our partnership with the municipality of Anchorage. The partnership was significant in providing COVID-19 management and mitigation efforts. So as an extension of the MOA Health Department team, we have provided citizens with resources, education, and tenacious workforce, leading to over 61,000 lives being touched by the different COVID-19 services provided, which included case investigation, contact tracing, contact monitoring, and vaccine line support. Our research shows that the data gained from the vaccine information line shows that 44% of the homebound Anchorage residents are willing to schedule their COVID-19 vaccination after speaking with vaccine educators. As I summarize also really quick, I'd like to also express that we have different lines of services that we provide. Our focus is to make sure that we work through the public health scope of work and not just limited to COVID. We do provide public health solutions in all areas to include schools and supporting communities, outreaches, disease investigations, research services, and grant funding help as well. For the school areas, we do have COVID-19 specific services for school specific needs. And some of that include having a liaison in the school. And essentially the summary of that is providing help so that educators and staff can be able to focus on education needs, and we can be able to take on that school health needs that needs to be addressed. The other one that has also risen naturally and we've been working with in schools is providing social and emotional needs services, because we understand the COVID-19 and other stress factors are negatively impacting the school and students. So we do have those services as well. But main point of this meeting for us was just to pause a little bit and thank you all. One, for working with us. Two, for giving us the opportunity to work and serve the community of Anchorage. And three, opening up that if you ever do need any of our help and services, we'll be more than willing to partner up, because it was very successful and we did appreciate the partnership. Thank you so much.
Great. Thank you so much for being with us here today. If folks didn't catch it, that's AMLLC, and they were held the contract tracing and contract with the municipality. And, you know, one of the things, I think the quick silver lining on COVID is we have created some new partnerships and some new tools in our toolbox. And I'm sure it's great that we can discuss further collaborations as appropriate. So thanks for being with us today. It was really great to hear about your work, and thanks for supporting our community during COVID.
Thank you as well. Have a good day.
You as well. So we're going to turn to our Community Health Advisory Committee update. I believe we are joined by Thea Agnew-Bambin. Are you with us?
So,
all right.
yep.
Go ahead.
Great. And is Cameron on the line as well?
No, he had a conflict today, so he is excused.
Great. Okay. I'll just give a quick update on this, and then happy to discuss any questions. So, and I'm glad Director Gerace is still on, because he can provide any supplementary information about this previous incarnation of this committee. But basically, back in probably February of 2021, the health department invited a diverse group of community representatives, healthcare representatives, lots of different kinds of people from different parts of the Anchorage community to come together to create a COVID-19 vaccine advisory committee. And this committee was convened at the request of the state. Remember, way back when we first got vaccines, it wasn't clear exactly how we should prioritize their distribution around the city, because we didn't have enough vaccines at the beginning to meet full demand. So we had to make some decisions about where and how to distribute vaccinations. And so it was really important to have a group of community members advising the health department on that process. And so that was why the group was convened originally, and they met monthly. They reviewed data. Many of the entities that were on that committee also then became grantees of the health department. I think Director Gerace referred to this earlier in the meeting today, where the city received some funding that was federal money through the state to the municipality to really address health disparities and to build health equity as part of our response to the COVID-19 pandemic. And so a number of community organizations that were also had representatives on this committee also ended up as grantees. And so part of what we were able to do with the committee was really, again, kind of bring this broad and diverse group of people together to inform how the health department really responded to the pandemic. And then, of course, as vaccines became more available, testing became more available, the committee really worked on some of the same issues that you were just discussing around what's the best way to get testing and vaccinations, what's the best way to communicate, how do we communicate with communities within Anchorage that aren't, for whom English is not their first language or who have other barriers to healthcare access. So the committee met monthly until the end of 2021. And at that time, just as Director Gerace said, when the health department stopped doing vaccination and testing directly, they determined that it wasn't necessary to continue to have this committee meet to advise on those operations. The committee members, however, really had a really good experience working together and really felt the huge benefit of having that kind of direct communication with the health department, with kind of at the system level here in Anchorage around healthcare and healthcare access. And so the committee really wanted to continue to have some type of a voice to help inform the health department and the assembly around the healthcare priorities and the healthcare issues that their communities were facing, and to have that group setting where they could really work on those together and help, of course, create action that will build equity, that will improve the health and well-being of all of us here in Anchorage. And so in that December meeting, Cameron Perez-Verdia joined and suggested that it might be advantageous for the Health Policy Committee to have an advisory group that would meet in between meetings of the Health Policy Committee to, again, help provide that community voice. And so last month, we had a kind of initial meeting to start basically just to kind of float that idea to the people who were previously members of the COVID-19 Vaccine Advisory Committee. We started to work on a draft charter, and Cameron and Meg also proposed 3 focus areas for the year, one being just general public health monitoring, receiving some of the same information that Director Gerace just shared, any continued monitoring of COVID-19. And then the third one was really focusing in on the Crisis Now implementation that's being supported by the Alaska Mental Health Trust Authority, and it's being supported statewide, but with Anchorage having some really great movement on that currently. So again, to provide a kind of community voice to help inform the implementation of that. And so, like I said, we had that one initial meeting, made some changes to the draft. One of the changes that the members suggested was that it go ahead and be called the Community Health Equity Advisory Committee and have a pretty strong focus on building health equity in our community and removing barriers to access and to eliminating health disparities. And then, so we've proposed a second meeting of that group to continue to work through that charter and to continue to see if this group is really interested in forming. It seems like there's some really good interest so far, and we want to now kind of engage more of the previous members of the earlier committee. So that's the update, and I'm happy to answer questions or have any discussion on that if anyone has any.
Great. Thank you so much. And thanks for your work in getting that reinstituted. Can you say the name one more time so I jot it down so if we do this again, we have it right on the agenda?
Sure. It's still provisional because the group wants to kind of think about it again. But right now it's the Community Health Equity Advisory Committee.
Got it. Thank you so much. Are there any questions about the Community Health Equity Advisory Committee? I'm not seeing any questions, but if any come up, I invite you to send those to Thea or get in contact with Cameron or myself as this group gets up and running. I do see a hand. Just a moment, please. Yes, Director Gerace, please go ahead.
Hey, thank you. Thea did an excellent job mentioning all the parameters that are around that group. I do want to note that we did try to engage that as part of our Health and Human Services Commission. And so one of the things, health wasn't in the position to totally eliminate it. We just wanted to really try to empower our Health and Human Services Commission that have been making many resolutions over those last few months and is highly active. We are blessed to have 6 very strong commissions here inside the health department, and Health and Human Services is one of them. And so there's also that avenue of addressing situations around health and health equity. So please keep in mind, I welcome them to participate. Everyone in the community is welcome to participate with our Health and Human Resources Commission, which is an outstanding group of individuals to get together and talk all aspects of healthcare. So please just note that too as a second direct avenue to the health department. Our commissioners provide feedback monthly on a variety of topics, but that is an excellent resource also.
Great, thank you so much. Appreciate that. And so I guess I have a question. Is there the opportunity for collaboration between the committee and the commission? For either, I guess for Thea, is that envisioned to collaborate with the commission, with the committee?
Oh, I think it certainly could. I mean, I think right now the way we've talked about it so far is really as a back and forth between this committee and the Health Equity Advisory Committee, that, you know, basically what happens here could then be discussed in that Health Equity Committee, and then their input can come back to you. And that since the health department participates in this meeting, that would be maybe a way to bridge to the health department, which would be great. But I think absolutely, I'm sure, you know, if the members are, you know, want to also participate with the commission, I think that'd be awesome. So, you know, it's just in its beginning stages, and hopefully could be something that continues on for, you know, until we feel like we're an equitable community, which we have a lot of work to do. So it could be a while.
Great, thank you for that. Yeah, I just always like to, sometimes with all of our boards and commissions, just want to understand the intersections and where the information is flowing. So thank you for joining us today, and thanks for the updates and all the hard work on getting that stood back up. I look forward to, and as we do move through, it's one of our goals to figure out how to get commissions and committee updates into our agenda on a regular rotation. So watch for that soon. We do know there are quite a few within the health department. Are there any other items members would like to discuss today before we turn to audience participation? I am seeing and hearing none. So with that, we'll open up for audience participation. You have 3 minutes to speak. And if you are on the phone, it is *6 to unmute. Would anyone like to speak? Anyone at all? All right, well, I will gladly hand back 10 minutes to everyone. Thank you for a really great meeting and very robust discussion. It's well appreciated. And with that, we'll be adjourned. Thanks so much.
Thank you.